what are the pros and cons of various treatment? So obviously, like I said before, the treatment is very individual, so you need to speak to your own doctor about all of this. But there are things to consider. So, like we just gone through a list of all the medicines. Some are tablets and some are injections. So I guess you've got to think about, weigh out whether or not you want to take tablets, or are you okay to have injections? And if you're not okay to have injections, is it because you don't want to inject yourself? So, i.e., subcutaneous injections, so into usually the belly or the thigh, or do you prefer to come in, to our infusion suite to have an infusion? Maybe would that be more comfortable with that? As well as that, there is to consider the frequency of treatment. So how often you need this treatment. So even from with the tablets forms of treatment, it can range from multiple times a day to the methotrexate, which is only once a week. So some people prefer to do it every day so they don't forget. Others prefer just to do it once a week because it's more convenient. Even injections as well can vary hugely in terms of how frequently they need to do it. All these treatments that I've discussed are all what we call immunosuppressive treatments. So they suppress the immune system to calm down the confused, naughty cells, but also they also calm down the good cells as well, so the ones that help you fight infection. So there is a risk of increased risk of infection, and different products, different medicines have different profiles for this. So it's something to consider if you've had various infections in the past. There's also, if there's been cancers in the past, we need to think about whether some treatment's better than others. Anti-IL-17 can sometimes increase the activity for Crohn's or for inflammatory bowel disease. So if you have Crohn's, then maybe not that one. And if someone has very bad psoriasis, then the dermatologist with the rheumatologist may consider one class of biologics over another, purely based on that as well. So there's lots to think about in terms of selecting the right treatment for you.